are back on the Doctorates Talk Show. I am your host, Jennifer Leslie. I'm here with my co-host, Dr. Catherine Tikem. And we are here with Dr. Ngozi Odoh. How are you doing today, Dr. Odoh?
I'm okay. How are you?
Thank you for coming. It's nice to have you today.
Nice to have you.
Wow. Well, we're going to be having an interesting conversation with Dr. Odoh. It's about the lack of certain vitamins. In fact, it's about
Vitamin D deficiency.
Vitamin D. And there are reports that vitamin D deficiency can actually kill you. How is that?
So true. Vitamin D is one of the fat-soluble vitamins that a lot of people with the symptoms, we can misjudge it or misdiagnose ourselves.
Okay, what symptoms are you talking about?
Like aching, pain. Some people might think they have arthritis, and they will Motrin, NSAID, Tylenol, which can be toxic.
Okay, but the reason that you're here today is because you're so concerned about this vitamin D deficiency that are actually killing people, are actually dangerous to the body. And people are actually misdiagnosing themselves. Isn't that right?
That's correct.
So, well, when we get sick, we go to the doctor. What do you mean misdiagnosing themselves?
Because when we go to the doctor, we tend not to tell the doctors what is going on. We not presenting the symptoms very well. We can say we are aching, it might be arthritis, but in reality, if we give the doctor the whole symptoms, what is going on, they can be able to walk us up to find out what's going on with us.
But a lot of these individuals that do end up with vitamin D deficiency and end up with really severe diseases as a result,
yes,
and even death. Isn't it? It's not because they're not going to the doctor and not because they're not telling the doctor about their symptoms. Isn't that correct? Isn't there much more to it than that? That's why we're here today?
That is true. Because vitamin D, by history, we always think it's something we can get in the sunshine. However, not everybody has opportunity to get the sunshine that is needed for vitamin D to be absorbed. The good news is that when we go to the doctor, we as a consumer or patient can tell the doctor, what is my vitamin D level?
Okay, there are two things that we need to straighten out here. Let's talk about sunshine.
Okay.
So the lack of sunshine can lead to the lack of vitamin D, hence vitamin D deficiency?
Correct.
Well, okay, so we live in Florida, right? A sunshine state. But how about if we lived in New York City or in London,
Okay.
where there's no sunshine?
If we live in certain city like that, and we know our blood work, that our vitamin D is low, we can take supplement, and we can get some replacement from the diet.
Okay, tell me about the supplements. Okay, so what diet? Are you talking about food, or are you talking about supplements that we buy over the counter?
Yes. Both. Some food like fish oil, salmon, and we have vitamin D supplement, which comes in a dose like 1,000. Should I say that?
But there are people that swear that they eat really well. They are on a good diet, and yet they end up with symptoms that is basically mimicking vitamin D deficiency disease.
That's why you have to go to your provider. Let them draw the blood work to make sure that it's not from vitamin D, because many symptoms mimic vitamin D deficiency.
Let them draw the blood work.
That's
well,
right.
If I'm a patient and I go to the doctor, it's his job to determine whether or not you need to draw blood work. Isn't that correct?
Correct. But the symptom you presenting, because vitamin D is not just a routine blood work withdrawal, unless you're presenting with a symptom.
How do you deal with the situation? Do you generally, when you assess your patients, do you automatically draw vitamin D or the vitamin D level, or, how does that work? Is that a routine part of your assessment or treatment?
I have made it as part of my routine because with me, over the years with my practice, many people who come to me with the symptom they present, sometimes my back is hurting me, I'm aching, it could be my arthritis. I have to walk them up to see if they are deficiency in vitamin D so we can start the treatment before giving them other medications.
Okay, so what we're finding out is that a lot of people are having pain. Okay. And they're not sure whether the pain is arthritis, or in fact, a lot of people believe that they do have arthritis. They're getting a little bit old. Not saying that if you're in your 60s, you're old, but they're getting joint pains, right? Knee pain, ankle pain, pain in their finger joints, and they automatically assume that they have arthritis. Okay. And do you find that's common? They're diagnosing themselves because they feel, I'm of the age and I'm sure that's what I've got. So it's not that serious. I'm just going to go buy some aspirin. I'm going to buy some Motrin. And is that dangerous?
It is dangerous.
Why is it so?
Because some of the medication we're taking can impact our system. Let's look at liver.
What are the common medications that they're taking for this presumed arthritic condition that could be dangerous?
Tylenol, excessive Tylenol can damage the liver. And we know that. And Motrin, NSAID, all those non-steroid.
What could that cause? What's the danger of taking NSAIDs, aspirin, Motrin?
Okay.
For a condition that you think it is, and it actually is not.
Isn't it true that it can cause GI bleed?
Yes, it can cause GI, stomach bleeding. Yes, right. It can.
Is that Motrin we're talking about?
Aspirin. We're talking about Motrin and aspirin.
And
we're talking about Motrin.
Is that correct?
Yes.
Yes.
Okay. Well, that's a lot of information. I just think that even with me, sometimes I get some joint pain. Mm-hmm. And now, there's food of thought, because instead of thinking that, I may be getting arthritis, I can now start thinking that, maybe I do have vitamin D deficiency. Maybe I need to go to my doctor and have him request that he draw a vitamin D level, right? He or she, instead of just assuming that I need to take aspirin, right?
Yes.
Okay. So, so what we're saying is that vitamin D deficiency can kill you. That is one of the diseases that you just don't want to take for granted. You won't know you have it unless you go to the doctor. But when you go to the doctor, make sure you let the doctor know that you're experiencing joint pain so that the doctor can properly diagnose you. And if you do have vitamin D deficiency, then he will give you the right treatment, the right medications, or the right supplements. And is there anything else?
Basically, you're saying, though, that we, the consumers, have to ask the doctors to do blood tests on vitamin D deficiency?
Yes. However, this topic is not only for the consumers, but for the provider as well. Because if we look back in the statistics or the study that have been done about
I meant to ask you about that. Evidence-based research.
Yes.
Is there any on that?
According to Journal of Nutrition Research, about 42% of people in the United States have vitamin D deficiency.
Oh my goodness.
Another interesting one, American College of Cardiology. They have indicated in some of their studies that about 32% of people can be at risk for coronary artery disease, which can lead to another heart problem. The last but not the least, a chief of internal medicine also indicated that vitamin D can be more prone in certain population, like African American, because of the skin, the melanin skin. So this topic of vitamin D is very, very significant because if untreated, and so many researches, arthritis research, rheumatology in Britain, they have indicated that vitamin D is very, very important, that we really need to look at it in depth, treat it, and I highly recommend that most providers need to put it as part of their blood work for their patients. And if your doctor did not order it, remind them, what is my vitamin D level so that I can know the amount to take because I'm not getting enough sunshine.
How about, going back to sunshine and sunscreen. I was reading up a little about that and finding out that if you use too much sunscreen, is there a relationship between the use of sunscreen and not getting enough vitamin D?
Of course, because when you're on the sun, you want to get, and before I answer that, we need to know the right time we will be getting the sun in the midday, because you don't want to stay excessively in the sun because of the cancer of the skin. However, some people use sunscreen. By doing so, you're really protecting or covering the absorption of the vitamin D that you're supposed to be getting in that sun. So,
but isn't there a risk and benefit to that, to the sunscreen? Because on one hand, if you use a sunscreen, you don't get the vitamin D, right? But on the other hand, if you don't use a sunscreen, then you may have problems.
So what you need to remember is what time of the day are you getting your vitamin D? At least 3 times a week. And if you're doing it before the midday, when the sun is still coming up, you don't need that sunscreen at that early morning. But if you know you will stay longer in the sun, then the sunscreen is important.
Okay.
Because excessive of everything is bad.
Well, the most important thing that we've covered is that the lack of vitamins can actually kill you.
Yes.
Thank you for coming.
Thank you. Thank you for
Stay
having me.
tuned. We'll be right back. And we are back on the Doctorates Talk Show, the show that raises your awareness about healthcare in the community. I am your host, Jennifer Leslie, and with my co-host, Dr. Catherine Ticam. And we are back with Dr. Sabine Saintable. How are you today?
I'm doing great, Jennifer.
We're glad to have you.
Welcome. Thank you.
Awesome.
Thanks for having me.
Today we're going to be talking with Dr. Sabine Saintable about a widespread disease that is causing people to have a second look at their lifestyle, like drinking and partying, and even your sex life. This disease is one of the leading diseases in the United States. We have so much to tell you, so stay tuned. Don't go anywhere. We'll be right back. So, Dr. Saintable, people are dying, dropping dead like flies at churches, at the dance halls, right?
Definitely.
And even out there at the football games. And I was going to say, even having sex. How comes?
Well, Since our topic today is about strokes, well, stroke is the 5th leading cause of death and disability in the United States.
Stroke.
Strokes.
So stroke is killing a lot of people. Is that what you're saying?
Yes. And the cause, there's many risk factors for strokes, but we know that one of the major risk factors is hypertension. And many people, as we know, hypertension is called the silent disease. Many people, they have hypertension and they will not know it because it doesn't have any signs or symptoms.
So what you're saying is that a lot of people who are dying from strokes, this is happening because they really have high blood pressure and they either don't know or they're not taking care of it, right?
Yes.
Okay, and so there is a connection between high blood pressure and stroke.
That's correct.
What is that?
Well, as we know, there's multiple risk factors for strokes. High blood pressure being one of the major risk factors. And when you were saying earlier that people are falling dead like flies, and it's true, they may have high blood pressure and not know about it. And as a result, in a time of high excitement, like in a football game, or they're in a stadium, they're at church, they're enjoying themselves, or maybe even in bed with their partner and they're having sexual intercourse, I've seen many people come into the emergency room and in the ICU.
Oh my goodness.
With either.
Oh my goodness. Now, that is scaring me. That is scaring me. And I don't want my audience to get too scared now. Because can you imagine being in the heat of a moment, right? Well, in church, you're jumping up, hallelujah, right?
Yeah.
Or, with your partner in bed. I mean, would you say that a lot of people, they just totally disregard that could happen?
Well, it's not even a thought. I wouldn't even say an afterthought. It's not even a thought for the norm, the regular lay people. We don't even think about, okay, is today my day that I'm going to have a stroke? We don't think about that. So that's why we're here today, to raise awareness that this can be an issue. And if you have high blood pressure and you're not monitoring your blood pressure, you're not taking your medication properly.
And what could happen if you're not taking your blood pressure medications?
Yes.
How does one recognize the signs and symptoms?
Right. Well, and that's what we're going to get to. When strokes began, someone began to have a stroke or some kind of stroke is basically when there's 2 types of strokes, either a hemorrhagic stroke where a blood vessel may rupture in the brain, or it could be an ischemic stroke where you may have a blood clot that blocks the perfusion of blood in your brain.
Okay, so basically what you're telling the audience is that they could either have a bleed or a clot,
Yeah,
right?
exactly. A bleed or a clot.
A bleed or a clot. So when there's a bleed or a clot, so there are these signs and symptoms. There are things that you must recognize in order to determine whether or not you're having a stroke. The only thing is that most of the times it's not going to be you who know that you're having the stroke. It's somebody else that's going to be noticing that you're having the stroke. So what are the common, without going into depth, right, about all of the medical terminology, what are the most common signs and symptoms that people need to look out for?
The most common signs of symptom that people will most likely see is maybe numbness and tingling of one side of your face or your arms or your legs. You may have a weakness, sudden weakness that just suddenly appears. You may get to have a sudden confusion, or maybe suddenly unable to speak clearly, garbled speech, slurred speech.
And everything is happening suddenly, right?
Suddenly.
Okay, everything is happening fast.
It's happening fast, or it's a quick progression.
Okay, and tell me a little bit more about this fast.
Well, fast is that's the acronym that we use to recognize it. We want to
recognize what?
To recognize the signs and symptoms of a stroke, where we talk about the face. If you're having numbness or one side of your face is weak, or your A stands for arms, maybe you may have weakness in one side of your arm or your legs. And S stands for speech. So your speech might be garbled or slurred or unclear. And T, it stands for time. Time means that time wasted equals brain loss. The longer you wait, the more brain tissue that's going to be destroyed during this time.
So let's repeat this for our audience. So to recognize that you're having a stroke, if you remember the word fast, you're doing good, okay? So the word fast, if you recognize fast or remember the word fast, F-A-S-T, F as in face, right?
Right.
Yes.
Arms
Right.
Yes.
and
S
speech.
stands for speech.
S is for speech and time,
Right.
Yes.
okay? Fast. So if you remember the word fast and somebody's suddenly like falling to the ground and you're not sure what's happening to them, think of the word fast. It
And we want you
could
to
be
act
that they're
fast.
having a stroke. They want you to act fast, okay?
Yeah. I also wanted to add that, although these are the common signs of strokes, but there are also some other uncommon signs. Like we said, there's either a bleed or a clot.
Right.
If these signs are most commonly in a clot, but if you're having a bleed, you may have the worst headache of your life. You may also have be totally unbalanced.
You're scaring me. You
Unable
are
to
scaring me
coordinate
because
yourself, or
don't
maybe having
we
dizziness.
all
But
sometimes feel
we-
these symptoms?
We sometimes have a headache, but you would want to remember that it's a new onset headache. This is something that has never happened to
Suddenly.
you before, right?
Yes, suddenly you might be in a gym bench pressing 300 pounds, and all of a sudden you have a strong onset of headache, and it's the worst headache of your life. You want to take it to the hospital.
Tell me something,
Fast.
Sabine. What happens when people who do not follow up with their blood pressure treatment? That you said that was a silent killer, but people say, I feel good, I feel fine, therefore I don't need my medication for blood pressure, which can lead to a stroke. What do you recommend for these people?
Well, if you feel good and you feel fine, there's no excuse for not taking your medication. However, you want to, if you choose not to, it's your decision. But please monitor yourself regularly on a daily basis.
And the most important thing to do is to follow up with your doctor. Always follow up with your doctor. And if you're not sure, always go to the emergency room find yourself to the emergency room. Isn't that correct?
That's correct.
You always want to be on the safe side. So
The primary care doctor is supposed to monitor this. So if
Yes.
you do routine primary care visits, you
Yes.
should be able to keep track of this. You need to know that whatever your doctor recommends, that you need to follow that medication regimen,
Yes,
right?
Yes, the best thing is to not stop any medication abruptly without communicating this with your physician.
So tell us, Dr. Saintable, why are you here today? Why did you choose to come here to tell the public about stroke? What is so significant or different from all of the other killer diseases? Why you find it necessary to let them know?
Well, because of the fact that it's so common, but many people misdiagnose it, and it causes so many disabilities, which can be reversed if it's caught early on.
Okay, so we're coming to the end of our show. We just want you to know that it's very important for you to follow up with your physician, regardless of the signs and symptoms that you're having. And we hope that we have raised your awareness about healthcare today. You're on the Doctorates Talk Show. We'd like you to watch us, stay tuned, and keep in touch with us by watching at hbctv.org, and you may also contact us at office@hbctv.org.